Vaginal birth and cesarean section are the two primary modes of childbirth, each governed by distinct physiological processes, medical indications, risks, and recovery patterns. While both aim to achieve the same outcome, a healthy mother and baby, the pathways by which they do so differ significantly. Understanding these differences is essential for expectant mothers, families, and caregivers, as the mode of delivery can influence short-term outcomes, long-term health, and future pregnancies. Importantly, neither method is inherently superior in all circumstances. The safest option depends on maternal health, fetal condition, and how labor progresses. Vaginal birth is a physiological process in which the baby is delivered through the birth canal following spontaneous or induced labor. It relies on coordinated uterine contractions, cervical dilation, and fetal descent through the pelvis. Cesarean section, by contrast, is a surgical procedure in which the baby is delivered through incisions made in the mother's abdomen and uterus. It bypasses the natural labor pathway and is performed either electively or as an emergency when vaginal delivery poses a risk to the mother or baby. One of the most fundamental differences between the two methods lies in how labor begins and progresses. In vaginal birth, labor typically starts spontaneously when hormonal and mechanical signals indicate fetal readiness and maternal preparedness. The body initiates contractions, cervical ripening, and fetal positioning in a coordinated manner. Even when labor is induced, the goal is to replicate these natural processes as closely as possible. In cesarean delivery, particularly elective cesarean section, labor may not occur at all. The baby is delivered at a scheduled time, often before the onset of contractions, which alters the hormonal and physiological transitions for both mother and baby. From a physiological perspective, vaginal birth offers unique benefits related to hormonal release and fetal adaptation. During labor and vaginal delivery, the mother's body releases high levels of oxytocin and endorphins. Oxytocin facilitates uterine contractions, promotes bonding, and supports breastfeeding, while endorphins help manage pain and contribute to emotional well-being. For the baby, passage through the birth canal compresses the chest, helping expel fluid from the lungs and prepare the newborn for breathing air. This mechanical and hormonal preparation is associated with lower rates of transient breathing difficulties compared to babies born by planned cesarean section. Cesarean section, while life-saving in many situations, alters this physiological sequence. Babies delivered surgically do not experience the same compression of the lungs or gradual hormonal transition, which can increase the risk of respiratory distress, particularly if the procedure is performed before labor begins. This is why elective cesarean sections are generally scheduled at or after 39 weeks of gestation, when lung maturity is more likely. From the maternal standpoint, the absence of labor-associated hormonal surges may affect early breastfeeding and uterine contraction after delivery, although medical support can mitigate these effects. The medical indications for each mode of delivery also differ substantially. Vaginal birth is typically recommended when pregnancy is low risk, the baby is positioned head down, and labor progresses normally. Cesarean section is indicated when vaginal birth would endanger the mother or baby. Common indications include placenta previa, where the placenta blocks the cervix, placental abruption, fetal distress, breech or transverse fetal position, multiple previous cesarean sections, uterine rupture risk, and cephalopelvic disproportion, where the baby's head cannot safely pass through the pelvis. Emergency cesarean sections may also be performed when labor stalls, the umbilical cord prolapses, or severe bleeding occurs. Risk profiles differ markedly between the two methods. Vaginal birth is associated with lower rates of infection, less blood loss, and faster physical recovery in most women. However, it carries risks such as perineal tears, pelvic floor injury, and in rare cases, complications like shoulder dystocia or uterine rupture. Long-term, some women may experience pelvic floor disorders, including urinary incontinence or pelvic organ prolapse, particularly after multiple vaginal births or deliveries involving forceps or vacuum assistance. Cesarean section, being major abdominal surgery, carries inherent surgical risks. These include infection, hemorrhage, injury to surrounding organs such as the bladder or bowel, and complications related to anesthesia. Recovery is generally longer and more physically demanding, often involving significant postoperative pain and limited mobility in the early weeks. Additionally, cesarean delivery increases the risk of complications in future pregnancies, such as placenta accreta, placenta previa, and uterine rupture. These risks tend to increase with each subsequent cesarean, making delivery planning more complex over time. Recovery experiences differ substantially between vaginal birth and cesarean section. After an uncomplicated vaginal delivery, many women are able to walk, eat, and care for their newborn within hours. Hospital stays are usually shorter, and physical recovery tends to be quicker. Pain is often localized to the perineal area and decreases steadily over days to weeks. In contrast, cesarean recovery involves healing from both uterine and abdominal incisions. Women may require stronger pain medication, experience limitations in lifting and movement, and need additional support at home. Full recovery can take 6 weeks or longer, and the presence of a surgical scar adds an additional consideration for long-term health. The impact on breastfeeding and early bonding also differs between the two methods. Vaginal birth, with its associated hormonal environment, often facilitates early initiation of breastfeeding and skin-to-skin contact. That said, many women who deliver by cesarean section successfully breastfeed, particularly when supported by healthcare professionals. Challenges such as delayed milk production, postoperative pain, and limited mobility can be addressed with appropriate guidance and assistance. Psychological and emotional factors are another area of distinction. Some women experience vaginal birth as empowering and fulfilling, particularly when it aligns with their expectations. Others may find labor traumatic, especially if complications arise. Similarly, cesarean section can evoke a range of emotions. For some, it brings relief and gratitude for a safe outcome. For others, especially when unexpected, it may lead to feelings of disappointment, loss of control, or failure. These emotional responses are valid and underscore the importance of counseling, informed consent, and postpartum mental health support regardless of delivery method. Neonatal outcomes also show nuanced differences. Babies born vaginally are exposed to maternal vaginal and intestinal microbiota, which play a role in shaping the newborn's immune system. Cesarean-born babies have different microbial exposure patterns, which some studies have associated with higher risks of allergies, asthma, and metabolic conditions later in life, although genetics and environment also play significant roles. It is important to note that when cesarean section is medically indicated, the benefits of avoiding serious birth complications far outweigh these potential long-term considerations. In terms of healthcare systems and resource use, vaginal birth is generally less costly and requires fewer medical resources than cesarean section. Surgical deliveries involve operating rooms, anesthesia services, longer hospital stays, and increased postoperative care. This distinction has implications not only for individual families, but also for public health planning and healthcare policy, particularly in regions with limited resources. Ultimately, the key difference between vaginal birth and cesarean section lies not in which method is better, but in how each serves the safety and well-being of mother and child under specific circumstances. Vaginal birth represents the natural physiological pathway and is appropriate and beneficial for most low-risk pregnancies. Cesarean section is a critical medical intervention that saves lives when complications arise or when vaginal birth is unsafe. An informed, flexible approach that prioritizes medical evidence, individual risk factors, and respectful communication allows women and healthcare providers to make decisions that lead to the best possible outcomes for both mother and baby.